welcome to Research Bites, your daily dose of science news. Vitamin D is a fat-soluble vitamin that has attracted much attention from scientists and doctors over the last decade. Studies have found that a lack of vitamin D is responsible for many diseases like obesity, depression, diabetes, dementia, and heart disease. In a recent study published in the journal Scientific Reports, a team of researchers have found a link between vitamin D deficiency and coronary artery disease in people having type 2 diabetes mellitus. Vitamin D comes in two forms, ergocalciferol or D2 and cholecalciferol or D3. Our body synthesizes D2 from vegetable sources, and D3 is produced by our skin when exposed to ultraviolet radiations or from fish supplements. Our body converts the two forms into active metabolites, which perform essential biological functions in different organs. They also help to release vital hormones like insulin. The researchers measured the levels of 6 vitamin D metabolites using liquid chromatography mass spectrometry. This is a technique in analytical chemistry to separate mixtures with multiple components. It is one of the best methods to measure vitamin D levels in the blood since it can structurally analyze each component and identify it. India has a long history of vitamin D deficiency. About 70 to 80% of the population suffers from it. An increased awareness about the importance of vitamin D has led to a trend of checking the levels in the body. The researchers performed an analysis to predict the incidence of diabetes among individuals with low vitamin D after considering factors like age, sex, smoking history, alcoholic history, and family history of diabetes. They concluded that individuals with low levels of 25-hydroxyvitamin D, one of the metabolites, have a risk of developing type 2 diabetes, while those with low levels of 1,25-dihydroxyvitamin D face a chance of being affected by coronary artery disease if they have diabetes. Coronary artery disease affects blood vessels in our body when plaque deposits on the walls of blood vessels and restricts blood flow. This causes an inflammation of the arteries, and a complete blockage can lead to chest pain or even a heart attack. This study is one of the first to associate deficiencies of metabolites of vitamin D with diabetes and coronary artery disease in Indian patients. The findings can help in assessing the risk of developing these diseases in individuals with insufficient vitamin D. Thank you for listening. This podcast was brought to you by Research Matters, a SciComm initiative by Gubi Labs. For more science-based stories, podcasts, and news, log on to our website www.researchmatters.in.